Hi folks, John Adamson, the Rehab and Documentation Guru. You ever had one of those aha moments where suddenly you realize you've been missing out on something that wasn't there? So I had that just now. So I work in home health and I do the Oasis. I do it quite a bit, in fact, and I think I know it pretty well and I know how to score people. Rarely do I have to worry about getting any corrections suggested because I'm pretty detailed, pretty thorough. But I had an aha moment. So usually I see patients that are high enough level that bed mobility is not necessarily an issue. Occasionally I'll get somebody that has bed mobility issues, but probably 95 to plus percent of my patients have independent bed mobility. They have problems with transfers and gait though. But I have a patient I went to see today. She transfers fine, she ambulates fine, but here's what she can't do. She cannot perform a supine to sit. And so I'm filling out the Oasis, and I get to section GG, and I'm looking at GG0170A, rolling left to right. She's got that. GG0170B, sit to lying down. She can do that. But wait a minute. Where's GG0170C, which would be lying to sitting? It's not there. I know there are sections of section GG that are not being analyzed right now, but this is a piece of data that we are not measuring. And this is where she struggles. She needs max assist to sit edge of bed. So that's like the one functional category I can say, because of her shoulder fracture she had 3 months ago, why we need to work on stuff with her functionally, and I don't have it. This has been not a concern of mine obviously before, because I hadn't really thought of that, but it's definitely a concern about the Oasis. Because there are times when the Oasis does not tell a good story. If you fill out everything and it's independent this, independent that, you've got a patient that probably is not homebound and doesn't need you in the home care setting. But you've probably seen situations where you went to treat a patient, you knew they needed home health, you knew they had deficits, there was things that you can measure that the Oasis did not capture. And that's a problem. So I'm going to do my due diligence and do a very detailed analysis of the problem with bed mobility. And I'm going to mention that the Oasis did not capture that in my assessment, so that Medicare can see the problem with their pure data just from section GG. Anyway, just some of my thoughts. Let me know if you've got any examples where the Oasis or any other assessment tool you were using or forced to use did not accurately capture why the patient needed therapy. Hope you're having a great day. Take care and God bless.